Hello, how are you? Happy Christmas, happy Russian Christmas. Hope you're all having a lovely time. You might all be off having a lovely time instead of listening to English. So anyway, I hope you're enjoying your Christmas. Oh, hi, how are you? Happy Christmas. Are you having a good time? So today we're going to talk a little bit about going to the doctor in England and different things that different ways of doing things. Okay, so again, if I speak too quickly, just type up a message to say slow down. I'll try and speak slowly, but if I get faster and faster, just tell me and I will slow down. Okay, so thank you for joining me at Christmas. Have you had a good day, or do you celebrate this evening or tomorrow more? Is it Christmas Eve today, or is it Christmas Day? Okay, right, so I shall start anyway. So, oh, hiya. So, in England, we obviously have the NHS, which is the National Health Service, or system, but they're the NHS, and it's a free service for everyone in England. Well, I say free, we pay for it through our taxes, but we don't pay when we go to see the doctor. So a doctor's appointment with the NHS you don't pay for if you're English. And we have our regular GPs. So a GP is a general practitioner, and they are the people, that's like your regular doctor. Okay, so, but we just call them the GP. So if somebody tells you to see your GP, it means you're your normal doctor. So it's a general practitioner, if I can spell it. So that's like a normal doctor. Okay, so your GP, hi, you've joined twice. Your GP is like your first person you would go and see. If you were ill and you weren't sure what the problem was, you would call your GP. And in England you have to register with a doctor's surgery, so you have to register your details, so you are on their list, and then when you call them up you make an appointment. I don't know if it's the same for every surgery, but certainly for my doctors, they're very busy, and so if you want an appointment quickly, you usually have to ring at 8 o'clock in the morning and wait to get an appointment for that day, and that they will say, is it an emergency, or do you have to see the doctor today? So normally, if it's something for my daughter, for example, and she's very unwell, I'll ring early in the morning to get her an appointment that day. But if it's something that maybe it's about me, so for example, I had a pain in my shoulder and it lasted quite a few days, weeks even, and it wasn't getting better, so I could then ring the doctor, but I booked an appointment for the following week. So you can book an appointment like far in advance, so maybe for the following week or the week after, but if you think you need the appointment either today or early the next day, you need to ring at 8 o'clock in the morning to get an appointment. And I think that is normal for most doctor surgeries. It certainly is for my doctor anyway, because they're always very busy, especially this time of year. So you have your normal doctor, your GP, and you would go and see them, and if it was something that they weren't sure about, or something specific that they thought you needed to get more help with, they would then refer you to a specialist. So a specialist is obviously somebody who specialises in the problem you have. So this would normally mean an appointment at the hospital. So, so it could be with the hospital, with a physiotherapist, something else, depending on your condition, I suppose. And it'd be in that certain department in the hospital. So you'd see the doctor, and then depending on how urgent they thought your problem was, they would then make a referral to the specialist, and you would get a letter in the post giving you the time and date of your appointment with the specialist. And that is normally at a health centre or at the hospital. So for me, my local hospital is half an hour away, and I would have to drive there to see somebody for something more specific. So that's a referral, and that's the doctor's referral. So the doctor or the GP refers you to a specialist. Specialist. Okay. So for minor conditions, so things that you think, I'm terrible at this because I never like booking doctor's appointments for myself because I think I'm wasting their time. I'm stupid. But there are other things that you can do. So if you don't think you actually need to see a doctor, you can go to the chemist, and the chemist, if it's something like an ongoing problem, or I don't know, maybe you think you've got a funny rash. Do you know a rash? Like when you have red spots on your skin, or you've got a cough that won't go away. Sometimes you can go to the chemist, and the chemist will give you something to help. They will know, or they will look at your problem, and they will be able to help you. And if they think it's something more serious, they will tell you to go to the doctors. Okay, but there are certain things, if you're not to yeah, you can wait for 2. I think it depends on how urgent they think the problem is, or how busy they are. So I think I had to see a specialist before, and I got an appointment within 2 weeks. But my husband is still waiting for an appointment, and he's been waiting for I think 6 weeks, and he still hasn't got one. So I think it depends on what the problem is, and how urgent they think it is, and how busy the department is. So it can be as quick as 2 weeks, or as you say, it could be up to 3 months. It just depends on the on where you're going and what the problem is, I think. So yeah, it's a bit tricky. I was lucky. Yeah, I was lucky, and my mum got the same. My mum had to go as well, and it was the same. But my husband is being unlucky at the moment because his appointment hasn't arrived. So I don't know. We shall see. But yeah, I think it depends on the thing. If they think it's something urgent, they will fast track it through. So they will make a note of it and say to go quickly if they're really worried. So yeah, so the chemist can sort out some problems, minor problems. Excuse me. And then if they can't deal with the problem, or if they're not sure, they will then tell you to go to the doctor. But you can also do what they call they can also do what they call self-referral. So that is when you go online and you find the people you want to see yourself, and you type in. I actually haven't done this yet, but I need to do it actually for my shoulder. But you do it online for things like, you can do it for physiotherapists. There are a few things you can do it for. I can't remember. Physiotherapists, and for like counselling and things. If you're feeling depressed, or you need to talk to somebody, they could do it for this as well. Oh, my phone doesn't like that word. yeah, so you can do this self-referral, and you go online, and and you just type in your details, and yeah, you say what the problem is and that you would like to see someone. And actually, I went to see the doctor for my shoulder, as I said, and for some reason she gave me some anti-inflammatories. Do you know anti-inflammatories? So there was swelling. Oh, yeah. There was swelling around my shoulder. It was the muscles were inflamed, so swollen, and she gave me medicine, so anti-inflammatories, to make it better. And she told me to self-refer to the physiotherapist. I'm not really sure why she told me to self-refer and why she didn't refer me. Maybe she was just being lazy. But I need to self-refer so that I can see a physiotherapist about my shoulder. So I will go online and put in my details and wait for the appointment to come through. So yeah, that's another way of seeing someone in England, if you want to. The other thing we have is what we call the 111 service. So this is the number you call if you have not an emergency. So, you know, if somebody needed to get to hospital, you were sure they had to go to hospital, you would call 999. But if somebody was very ill, and it was like the weekend or late at night, and you couldn't speak to a doctor, but you didn't think they needed to go to hospital, you could ring 111. So the 111 service gives you advice, and then you can speak to a doctor, or a doctor will call you back, and you will explain the symptoms, and they will tell you if you need to go to hospital or if you need to see the out-of-hours doctor. Okay, so it's quite a useful service. I have used it before. We say out of hours, so, you know, weekends and evenings. But not for emergencies. Emergencies is 999. I will go into that in a minute. I wish it had a thing on here where the capital letters would stay on. It doesn't. Okay, so 111, you call up and you call this number, and somebody will answer the phone, and they will ask for your details. So they will ask for your information, like your name, address, date of birth, I think. And then they will ask about the patient. So if I call for my daughter, they will ask for my details, and then they will ask for my daughter's details. So they want to know who they are speaking to and who the patient is, because often the patient is not the person who is speaking if they're very ill. So they will ask for this information, and then they will ask what the problem is. But what they will do is they have like a list of questions that they have to ask you, and some of the questions are seem irrelevant. They seem pointless because you have told the person the problem, but they have to go through this list with you. Doesn't matter what you've told them, they have to ask these questions. So sometimes they will ask you if the person is bleeding, if they are unconscious, and so on, even though you've probably told them the symptoms in the first place. So once they've asked you all these questions, they then ask for the symptoms and talk to you about the patient, and they ask further questions to try and get a good idea of what's going on, and then they take your phone number, and if they think it's necessary, they will ask an out-of-hours doctor to call you back. And then you have to wait for the doctor to call you back. If you think the problem's getting worse, between them calling them and the doctor calling you back, you can call 111 again, or if it's really bad, you can call 999. So for me, the last time I used the 111 service, I think I waited for, I think normally they say it's going to be within an hour. I think I have waited for an hour and a half before for a doctor to call me back, but normally it's within the hour, but it depends how busy they are, I suppose, that night. So last time I think it took an hour and a half for them to call back. And then once you've spoken to that doctor and you've told them the problem, the symptoms, they will tell you if you either need to go to A&E, which is the emergency services, so accident and emergency. So they might say, go to A&E, just drive yourself. Or if they think it's a really big problem, they will say, we're sending an ambulance. Or they might just tell you, it's fine, if you don't feel better tomorrow, go to see your doctor, and it should be okay. So I've been told to take my daughter to A&E, but to take her by car, so it wasn't a massive emergency, but we had to go to A&E to be checked. And then the last time I called, he told me to see the GP the next day. But they will always tell you to call back if you're still worried. You can call them as many times as you like to say if you're still worried or what the problem is. Okay, so A&E, if somebody tells you to go to A&E, it's accident and emergency. Accident emergency at the hospital. And be prepared to wait for a long time. And 999 is your emergency call. So 999 is emergency for ambulance, police and fire. So if you call 999, they will do the same. They will ask you who you are, where you are, what the problem is, and they will normally they will keep talking to you and helping you with the situation. If it's an emergency situation, they will give you advice whilst you're waiting for the ambulance. And I mean, I'm not sure if there's a certain limit to time it can take an ambulance, but they come as quickly as they can. I suppose it depends where the ambulance is and how many calls they have as to how long it takes to get to you. But they usually keep somebody on the line. When I say on the line, I mean on the phone. So there's somebody talking to you and telling you what to do and how to help the situation. And they try to talk you through, so to explain what the best thing to do is in this situation. So that's your 999. If you have to go to A&E, accident emergency, you would go there for injuries, like if you've broken your leg, if you've cut yourself, if I don't know, anything. If somebody's become unconscious, they have to go in the ambulance. If you think you've got concussion, concussion, like if you banged your head and you can't remember properly and you feel sick and you have a headache, you go to A&E to get checked. Anything like this, any kind of injury, you would go to A&E, not to the doctors, because if you need stitches, you know, so if you have a very deep cut and they need to sew you back together, you go to A&E. Anything like this. But A&E can be quite a long wait, depending on the time of day you go and the day you go. So we were unfortunate that we ended up having to go to A&E with my daughter on a Saturday night once, and it was horrible. Luckily they have a children's place to wait, because it was full of people who had got too drunk and injured themselves. So we went in the children's area, but I think we waited for maybe 2 or 3 hours to see somebody. I think it was a very long time anyway. I think we finally got onto the ward. We saw somebody. You see, a doctor will come and talk to you and make sure it's not, you know, that you're not in immediate danger. And once they realise you're not in immediate danger, then you wait. Obviously, if you are, you know, if it's something really serious, they will take you straight through. They're not going to leave you. But once they assess the situation and they think, oh, you know, you're okay, you can wait, they leave you to wait. So I think we had to wait for 2 or 3 hours. It was forever. I think we were up all night. Horrible. Anyway, but she was okay and it was okay. So yeah, so you've got, these are the main ways. So if you're not too ill and you just want some advice, you would go to the chemist. You can self-refer, you know, if it's physiotherapist, mental health, there's something else, I can't remember what it is. But you can go online anyway and you look at NHS self-referral. you can make your own appointment. You can go to your GP. Your GP can send you to refer you to a specialist to get more help. You can call 111 if the doctor's surgery is closed and you need some medical help. You can call 111 if it's not an emergency. If you just think, I'm not really sure, I'm not sure if we should be doing something or not, and it's one of those situations, you'd call 111. And if it's an emergency, you know, you've just chopped your finger off or fallen out of a tree, you call 999. Okay, and that's the emergency one. That's the really serious one. Okay. If anyone has any questions or you're not sure, if there's anything more specific you want to know, just let me know. Is my GP good? Yes, but I don't see the same person every time. So if it's something, so if I just ring in the morning, like if it's something and I want to see somebody today, then you just take whichever doctor you can have. But if there's something specific that I want to talk about, I can request a certain doctor if I want to. And there's probably 2 doctors that I prefer to have, but we don't always get a choice. So if I don't have a choice, I will see any doctor. And they're all pretty good. I don't have any complaints. So yeah, I think they're okay as long as you're clear about what you go for and try and ask the right questions when you're in there. Because sometimes I think, or give them as much information as you can, then they're pretty good. Sometimes I think, oh, I forgot to say something. But certainly for children, they're very good. If I ring up, because my daughter's so young, if I ring up and say, you know, I need someone to see my daughter today, she's only 4 and I'm worried, they always make an appointment. Because we went on, what day is today? Monday, Friday. Myrtle was, it was Friday when I did this and she wasn't well. So we went on, what time did I call them? Sorry, I forget. Oh yeah, she said she was complaining about her ear, and I called them at 12 o'clock lunchtime, and I didn't think I'd get an appointment. And they got an appointment for her, because I said, you know, she's 4 and she says her ear hurts and it's the weekend tomorrow, so I'm really worried that we're going to go to the weekend and she's going to have a bad ear infection. And they do, that's the other thing they do. So they told us to come at 5 o'clock and sit and wait. So you have the duty doctor, and the duty doctor just takes patients as they come. Do I have a personal psychologist? Do I know? That's a good question. No, but I think I need one. Sorry, it's just a funny question because no, it's not that popular in England. I think maybe more people should have psychologists. Maybe I should have one. Dave, thanks for joining. Is this popular in is this popular in Russia? Do you have personal psychologists, or is it just is it quite an American thing? In America, I think they have a lot of personal psychologists, but not so much in England. Maybe we should. I'm not sure. Sorry, that makes me laugh. Sorry. Okay. What was I saying? Oh, the sit and wait. Yeah. So if you have an appointment, if they can't give you an appointment and you really want to see a doctor on the day, they will tell you to come at like 5 o'clock. Yeah, it's more American. They will tell you to come at 5 o'clock. Oh, okay. Your cousin is a family psychologist. So what does so is a family psychologist for everyone goes to see them? Everyone in the family? Or is it just means that he's like a general psychologist? Like, how is that just, I don't understand. So a family psychologist means that you have your whole family is with this psychologist and you all go to see him. That does sound like an American thing, but now it's Russian too. We don't really have that in England. I mean, we have psychologists and we have counsellors, so people that you can speak to, like you can go for. She works with parents and children. Oh, okay. Okay, and is it like counselling as well? So counselling is different to psychology in that it's sort of just more of a, when you need to go and talk to somebody, not necessarily that you've got a mental health problem. It's just you want to talk to somebody about things and have a bit of a chat and get some advice, and that would be counselling. And we have lots of it's good for in England if you've just had a baby, and when you're pregnant and things, there are quite a lot of mum and baby groups and centres for parents to go with their children, with their newborn babies. And I don't know if any of you have children or it interests you, but so when you have your baby, you obviously have a midwife who you go and see every few weeks. I can't remember. So you go and see your midwife every few weeks and she checks everything. And then once you've had your baby, you have a lady called a health visitor, and she comes to your house a few times in the first few weeks when you've just had your baby. She comes out and she checks you and she checks the baby and she talks to you, to make sure everything's okay. And then you can go to the baby centre. I think you go every week to start with. My memory's terrible. It was only 4 years ago. You go every week and you weigh your baby. The people weigh your baby for you, and you can ask them any questions. So if it's your first baby and you're thinking, my God, what's happening? What should I do? They weigh it and they will talk to you. Yeah, some counselling is free. I think, yeah, not all, but I think there are lots of free counselling services as well. Yeah, so they'll do this and they will be there to talk to you and to help you. And then there are parent and baby groups that you can go to and they give you advice on what you should be doing and things like this. It's quite helpful. It's very good. And they have also things like breastfeeding groups. So, there's numbers you can call if you're worried that your baby's not having enough milk or anything like this. You can call people and talk to them and they will come and see you. So it's very supportive in that way. It's good, and that's all free, completely free, all free advice and help. Yeah, I think counselling, there are different counselling services. Depends on where you live as to what services there are and what help they give you. I can't remember what else I was going to tell you. Oh yeah, so when you see the doctor as well, so going to the doctor is free. Well, not free, because you pay for it with your taxes. I always get told off when I say it's free. Everyone says, we pay for it with our tax. But you don't pay for your appointment. But when you get a prescription, so when you go to, so if the doctor says you need this, they give you a prescription. And if you're over 18 and working, you have to pay for your prescription. And they are, I think, £8 now. For every prescription is £8. So for children, the prescriptions are free. And for adults, you pay £8 if you're working and you're over 18. If you're a student, it's free. And if you're not working because you're not working, because you're, you can't get a job or you've got bad health, then it's free as well. And then things like the dentist. If you go to the dentist in England, again, if you're an adult and you're not a student or anything, then you pay. And I think for a checkup, so like the one every year, you can have your appointment for a checkup, so they make sure everything's okay. That's about, I think it was about £35 last time I went. And then any other treatment on top of that is extra. But it's still quite cheap. I remember when I lived in Ireland and I had to have they call root canal surgery on my tooth. It was horrible. And it was cheaper. It was cheaper for me to fly back to England 3 times and have my teeth fixed on the NHS than it was to get them fixed in Ireland. Because in Ireland, where you pay for everything, it was, I think, going to be about €1,500. So it was much cheaper. And children are free for the dentist. So until you're 18, it's free, which is good. Yeah, and so in Southern Ireland, so Northern Ireland is obviously the same as the UK, but Southern Ireland is, you pay for doctor's appointments. I think they're like, you have to pay, I can't remember, it's 9 years ago that I lived in Ireland, so I can't remember the price, but you have to pay for everything in Ireland. So yeah, dentist, you do have to pay as an adult, but not too much. And the optician you pay for, obviously. So for glasses, again, children have the opticians, their eyes tested for free. And you can also get free glasses with the NHS for children. But for adults, you have to pay for your eye test and pay for your glasses. And I found out 2 weeks ago that I now have to wear my glasses every time I drive my car, because it's illegal if I don't, because my eyes are so bad now. So I have to remember to wear my glasses, which isn't very good. What else would you like to know? Do you have any more questions about the NHS? Oh, so you can go private as well if you like. If you're rich, you can have a private doctor, and obviously you just pay. I don't know how much it costs, because I've never. We say to go private, and to go private means to go to a private doctor, and you just register and you pay, and you can go to a private hospital. You can have private dental care, and all of these things you can have. They're more expensive. And you probably don't have to wait as long, because there's not so many people that use this service. So I suppose if you're really worried about something, you're really concerned, and they're told you're going to have to wait for 3 months, you might decide, actually, I'm going to go private And if you have, then you can have health insurance as well. So if you have health insurance, then you can use that if you go private, I guess. Yeah. So that's what else you can do. So I was going to tell you. I was going to give you a few illness idioms or expressions. So we often talk about things like people often use this expression. They might say, "There's a bug going round." Ooh, my phone doesn't like the word bug. It's saying big. No, you're wrong. A bug going round. And if there's a bug going round, it means it's an illness that everybody is getting. Everyone is catching. Everyone's contagious. So when you talk about school, you know, there's a bug going around the school. Everyone at school is ill. Oh, and yes, there are also things like yeah. So there's a bug going around. A bug is an illness, as well as being an insect, but an illness. Like it could be a cold or a... Oh. Sorry. Stop doing that. So, and people might say, if you say that you're feeling under the weather, if you feel under the weather, it means that you feel a little bit ill, but not, you know, you're not really, really ill. You just feel like you feel tired and just not your best. You don't feel 100%. Okay, but if you say, people often talk about being at death's door, and it's a horrible expression. It means you're really, really ill. It doesn't necessarily mean you're going to die. People use it as like an exaggerated way, or to emphasise that they're feeling really well. So it's like you're exaggerating, because you're not actually. hopefully you're not actually going to die, but it's like to exaggerate that you feel really ill. Excuse me. Does anyone have any specific questions about any of this? Because if you do, then just ask and I will try and answer them. Or any questions about vocabulary and such like. Do you have so yeah, so if you just feel, so if a bug is like the illness that everyone gets, you know, and we use the expression to catch a cold, or to catch the bug that's going around. When you catch it, it means that you've got it. So it's not like you've caught it and you say to catch a cold, to catch the bug that's going around, or to get the bug, and that's what it means. Yeah. And then we also have, I don't know if you have the same, but children often have vaccinations in England against things like measles, mumps and rubella. They have vaccinations for them, and they have vaccinations when they're babies for all sorts of things. I can't remember the list, but you have to go when they are only a few weeks old, and then again in a few months. I think there's about 4 sets of injections that babies have between being born and going to school. And now there's also a free flu vaccination. So children get like a squirt up their nose when they're at school for young children, and people over 60, I think that's correct, over 60 get a free flu vaccination, like an injection in their arm. And people with illnesses who are more susceptible. So if you have asthma, for example, you'll get a free flu vaccination. I think if you have diabetes, you get a free flu vaccination as well. So there are lots of things like that as well. And if you want to, also in England, if you want to give up smoking, or if you want to give up alcohol, you know, if somebody's an alcoholic and they want to they want help, there is all free help for these things as well. So you can go to clinics for free and get help that way. That's all part of a free service in England, to try and make people more healthy, I guess, to just stop them killing themselves. So yes, there's all these services are also for free, and normally when you go into the doctor's surgery or into the chemist, they have all this stuff about it as well. So if you went to the chemist and you wanted to explain your symptoms, for example, you know, you might say, you can use expressions like I have a sore throat, or I have a pain. We have 3 ways of saying the same thing, really. So you can say, I have for example, a headache. But you can also say, I have a pain. Pain in my head. And you can say, my head hurts. Okay, and you can use this for all your, excuse me. You can use that for all your body parts, depending on what aches or hurts or pain. And it's the same. It's just the same thing, just 3 ways to say the same thing. Okay. We also have one which is another idiom. You could say, my head is killing me, or my back is killing me, or whatever. It can be any body part again. It doesn't mean you're actually dying. It just means it really, really hurts. Okay, so it means there's a it's really painful if it's killing you, but it's not killing you. It's just really painful. Okay. Does anyone have any questions? Does anyone have any questions about what they might do that they're worried about? Anything I can help with? Okay. Well, I shall leave you then to go and enjoy your Christmas. So I guess you are going to have a lovely meal tomorrow, and you're all on holiday. So have a wonderful time, and I will see you again on Thursday. Okay, Merry Christmas. See you later. Bye bye.